Welcome to the Explainer. So today, we're going to jump into something that's like the absolute backbone of nursing, ADPIE. It's the step-by-step process that helps bring a clear, effective plan to the sometimes chaotic world of patient care. We're going to walk through the first three super important stages: assessment, diagnosis, and planning.
Think about it. In the crazy, fast-paced world of healthcare, how do nurses possibly keep everything straight? When a patient's health is literally on the line, how do you make absolutely sure that nothing gets missed?
Well, the answer is something called the nursing process. And it's not just some boring checklist. It's a really smart, systematic approach that basically gives you a roadmap for every single patient, making sure care is thorough and actually works.
All right, so let's get right into it. Step 1, assessment. And I really love this subtitle, The Detective Work, because honestly, that's exactly what it is. A nurse's first job is to put on that detective hat and start gathering all the crucial clues about what's going on with their patient.
So what's the first thing you do? It's all about gathering info. You're pulling in every piece of data you can get your hands on, from reading the patient's history to listening to what they're telling you right now. And this info, it really comes in two main flavors.
And this brings us to a really important split. First up, you've got subjective data. That's what the client says is going on. It's their experience. And then there's objective data. That's the hard evidence, the stuff you can actually observe and measure for yourself.
So, subjective data, think of this as the patient's side of the story. It's what they tell you they're feeling. A stomach ache, chest pain, a headache, feeling nauseous. You can't see it, you can't measure it, but it is a super important piece of the puzzle.
And then you've got the flip side, objective data. Now this is the stuff you can see, measure, and verify for yourself. We're talking about findings from a physical exam, their vital signs, things you can actually see, and of course lab results. This is the data that can back up or sometimes even challenge the patient's story.
Okay, so you've gathered all your clues. Now what? That brings us to step 2, diagnosis. And this is where the role-playing changes a little. You go from being the detective to being the strategist. It's time to look at all those clues and figure out what it all means.
So the whole point here is to take all that data, the subjective stuff and the objective stuff, and use it to form a nursing diagnosis. Now, it's really important to remember this is not a medical diagnosis, like a doctor saying you have pneumonia. A nursing diagnosis is all about how the patient is responding to that health issue.
But here's the thing, right? Patients are complicated. They almost never have just one single problem. So that begs a huge question. When you've got a whole list of issues, where in the world do you start? What's the top priority?
Well, the rule of thumb is pretty clear. Physical needs always come before psychological ones. You've got to follow Maslow's hierarchy. Think about it. A patient struggling to breathe, that's always going to be a higher priority than, say, them feeling anxious about being in the hospital. You have to take care of the immediate physical threat first.
And I love how the source material puts this. It's a little blunt, but man, is it a great way to remember this. It says, just think what is going to kill your client the fastest. Whoa. But it works, right? That one question just cuts through all the noise and forces you to zero in on what's most critical, right now.
All right, let's test this out. You've got a patient. Their oxygen saturation is 89%. I mean, that's low. So using that what's going to kill them fastest logic, what's the most urgent problem here? Yep, impaired gas exchange. That's the physical issue that's got to be dealt with immediately. Okay, how about this one? A client is feeling totally overwhelmed and doesn't have a support system. Now, these aren't immediate life or death physical things, but they are still a really big deal for the patient's overall health. So what's going on here? All the clues are pointing to those psychological and social challenges, which makes hopelessness and ineffective coping the perfect diagnoses to focus on.
Okay, so we've assessed the scene, we've diagnosed the main problems. Now it's time for step 3, planning. And this is where the nurse gets to be the architect, designing the actual blueprint for how to get this patient better.
And a really great plan isn't just a bunch of ideas. It's built on what we call SMART goals. You might have heard of this acronym before, and it is a total game changer. It means every single goal has to be specific, measurable, attainable, realistic, and timely. It's how you turn a vague idea into a solid, actionable plan.
Let's see this in action because it makes a huge difference. A kind of poorly written goal would be something like, client will walk without dizziness. I mean, how do you measure that, really? But a SMART goal? That's super specific. Client will demonstrate improved activity. Something like being able to walk 50 feet down the hall with assistance twice a day.
See? Now everyone on the team knows exactly what we're aiming for.
And this next part is so important. You can't forget that the patient is part of the team. They're not just someone this is happening to. You have to talk with them about the plan to make sure it's actually going to work for them and that it's addressing what they feel are their biggest needs.
So, let's put that to the test. What's the best way to figure out if the plan you've made actually lines up with what the patient needs? It's the simplest thing in the world, but it's probably the most important. You just talk to them. You discuss the plan together.
All right, let's do a quick recap and pull these first 3 steps together.
You can really see how it all flows, right? You start as the detective during assessment, gathering all your subjective and objective data. Then you put on your strategist hat for the diagnosis, figuring out and prioritizing the problems. And finally, you become the architect during the planning phase, designing that smart action plan. See how each step just builds right on top of the one before it?
So, you've done all this work. You've assessed, diagnosed, and planned. The blueprint looks perfect. But now what? What happens when the rubber meets the road and you actually have to do the plan? Well, that's where the next 2 steps, implementation